Technical Veterinary Learning Channel, honored by Professor Ahmed Mamdouh El-Sherif, Professor of Epidemiology and Infectious Diseases, the ex-head of Department of Veterinary Medicine, the ex-Vice Dean of Faculty of Veterinary Medicine, Bani Suef University, Egypt, presents today Epidemiology series to be continued. Today, we will speak about approach and methods of epidemiology, including a case definition and rate measures. Epidemiology approach and methods. As with all scientific endeavors, the practice of epidemiology relies on a systematic approach. In very simple terms, we have to count, divides, and compares. Before counting cases, however, must decide what a case is. This is done by developing two case definition, then using this case definition to collect information about the diseased case, then performs a descriptive epidemiology by characterizing the cases collectively according to time, place, and population. To calculate the disease rate, we divide the number of cases by the size of the population. Finally, to determine whether this rate is greater than what one would normally expect, and if so, to identify factors contributing to this increases. We have to compare the rate from this population to the rate in an appropriate comparison group using analytic epidemiology techniques, and these actions will be described in more detail below. Epidemiology approach and methods. We are describe the counts, divides, and compares. Count cases or health events and describes them in terms of time, place, and animals or persons. Divides the number of cases by an appropriate denominator to calculate the rates. Compare these rates over time or for different groups of animals and peoples. A case definition. It is a set of standard criteria classifying whether an animal or man has a certain disease, syndrome, or other health status. Guarantee that every case is equivalent regardless of when or where it happened or who defined it. Before counting cases, the case definition have to be done. So, some case definition, particularly those used for the surveillance, have been developed and adopted as standards that ensure comparability. Use of an agreed upon standard case definition ensures that every case is equivalent, regardless of when or where it occurred, or who identified it, as all the team of epidemiology have to be practiced or identifying the case by the same character. Furthermore, number of cases or rate of disease identified in one time or place can be compared with the number or rate from another time or place. For examples, number of lumpy skin disease cases in Egypt at Bani Suef Governorate during 2012 and 2013 could be compared, as well as this number in area of Victoria Lake in Uganda could be compared at the same time. The number of lumpy skin disease in Gaza Strip at occupied Palestine at the time of 2012 and 2013 could be also compared. We can compare the number of SARS-CoV-2 infection at March in Wuhan zone in China with those cases at the same area in April 2020. So, when everyone uses the same standard case definition and a difference is observed, the difference is likely to be real rather than the result of variation in how cases are classified. Other case definitions, particularly those used in local outbreaks investigation, are often related to the local situation. For example, a case definition developed for an outbreak of foot and mouth disease illness might require laboratory confirmation where such laboratory services are available, but likely would not if such service were not readily available. So, case definition have to be practiced by all the epidemiology team to have the difference in numbers and of cases. Components of a case definition for surveillance and outbreak investigation. A case definition consists of clinical criteria and sometimes limitations on time, place, and person. The clinical criteria usually include confirmatory laboratory tests if available, or combinations of symptoms, subjective complaints, subjective symptoms seen by owners, signs, objective physical findings, and or other findings. Case definitions used during outbreak investigation are more likely to specify limit on time, place, and or animal or persons than those used for surveillance. Contrast the case definition used for surveillance of foot and mouth disease and for foot and mouth disease outbreak investigation. See in this box where foot and mouth disease surveillance case definition we described the clinical description. Infection caused by foot and mouth disease, and here we said 3 serotypes as we in Egypt, or put all the serotypes in your country, which may produce several clinical syndromes, such as fever of foot, vesicles and ulcers in mouth area, laminitis, and tick of hoof, and deaths of calves. Laboratory diagnosis, isolation of foot and mouth disease virus from mouth and blood of affected animals. Case classification, confirmed a clinically compatible case that is laboratory confirmed. Source, we here write the source of the case, veterinary medicine, decorate, and its laboratory in the area. And we here written the name of veterinary authorities. Case definition for infection condition surveillance. We write the definitions of the case, and then recommendation and reports. The year of recommendation and report, the number of other signs of the case, and report pages number. In foot and mouth disease outbreak investigation, we said about the case definition, clinically compatible illness with isolation of foot and mouth disease virus from mouth and the blood of affected animal. The place of outbreak in a farm of cattle production. And we write completely the address in details. With onset between, we here specified the time of occurrence of this investigation and of the outbreak. a case definition for surveillance and outbreak investigation. The example here is for human medicine, Kawasaki syndrome. Case definition. The clinical description, it is a case of children with febrile illness of greater than or equal to 5 days duration, with at least 4 of the 5 following physical findings: bilateral conjunctival infection, oral changes, erythema of lips or oropharynx, stauroperi tongue or fissuring of the lips, peripheral extremity changes such as edema, erythema or generalized rash, cervical lymphadenopathy, at least one lymph node greater than equal to 1.5 cm in diameter. Laboratory criteria for diagnosis, none. Case classification, confirmed a case that meets the clinical case definition. Comments if fever disappears after intravenous gamma globulin therapy is started. Fever may be of less than 5 days duration, and the clinical case definition may still be met. So, Kawasaki syndrome here is a physical, medical case, not occurring as outbreak. So, the case definition is as we described before. Variations in case definitions. Case definitions may be also vary according to the purpose for classifying the occurrence of any disease. For examples, veterinary authorities or medical health authorities need to know as soon as possible if any animal or any person has symptoms of lumpy skin disease or foot and mouth disease, equine influenza, brucellosis, or tuberculous animal. Or in case of human, they want to know as soon as possible symptoms of plague or anthrax. So these authorities can be planning what action to take for such rare but potentially severe communicable and pandemic diseases or epidemic diseases of animals, for which it is important to identify every possible case. The veterinary authorities or medical health authorities use what's called a sensitive case of definition. A sensitive case of definition is one of that is broad or loose in the hope of capturing most of all of the true cases. For example, the case definition for a sensitive case we can use if we suspect a case of blue tongue within a sheep flock. So, any animal show fever, bluish coloration of mouth area, increased rate of mortality within sheep flocks may be denoted to blue tongue. In case of human, suspected cases of German measles or rubella is any generalized rash illness of acute illness. This definition is quite broad and would include not only all cases of blue tongue or rubella, but also another cases with the clinical symptoms with blue tongue or with rubella can be taken within. So, sensitive case of definition is that it is includes the most of all the true cases. The disadvantage of this sometimes include other illness or other symptoms of diseases as well as. On the other hand, any epidemiological studying the causes of a disease outbreak usually want to certain that any animal or person included in this study really had the disease. the epidemiological study will prefer a specific or strict case definition. For instance, in an outbreak of foot and mouth disease in case of animals, or Salmonella agona infection in case of human, can be included. In this setting, the only disadvantage of a strict case definition are the requirement that every epidemiologist have to be defined that everyone with symptoms be tested and have laboratory diagnosis and an under determination of the total number of cases if some animals or peoples with salmonellosis or with E. coli infection or was mastitis or was rubella or with salmonellosis are not tested. One of the basic tasks in infectious disease studies and or public health studies is identifying and counting cases. These counts derived from case reports submitted by veterinarians, healthcare workers, and or human medical laboratories or veterinary animal laboratories to the both veterinarian department and human health department. This allows infectious disease and public health authorities to determine the extent and patterns of disease occurrence by time, place, and animals or persons. This may be also indicate clusters or outbreaks of the disease in the populations. Counts are also valuable for health planning. For examples, a health official might use counts numbers to plan how many infection control, isolation unit, or doses of vaccine may be needed. These counts also valuable for veterinary planning controls for the decided the number of population and the doses of vaccines needed, or how many plans could be applied in one country, such as Bank's plan for control of tuberculosis or single intradermal test for the whole country, and this decided by the economical position and budget of the veterinary authority in every country alone. Examples for cases counting during the last pandemic of SARS-CoV-2 in China at 10 March 2020, the total number is 80,924 confirmed cases, 20 new cases in the same day, with total 3,140 deaths, while in 30th April 2020, the number be 84,373 confirmed cases with new confirmed cases in the same day. The total deaths increased to reach to 4,643 deaths, while in 8th of May today, the official of China said that the total number be 84,415 confirmed cases with 6 new cases for the same day, with the deaths at the same level. This counts give an idea about the distribution of the disease and said to local authorities and to health authorities if the planning is succeeded or failed. However, simple counts don't provide all the information for veterinary or health department needs. For some purposes, the counts must be put into context based on the population in which they arose. Rates are here measures that relate the number of cases during a certain period of time, usually per year, to the size of the population in which they occur. For example, during the year of 2006 in Egypt, lumpy skin disease caused deaths for 2,800,000 animals. This equals about 40% of the total of animal population in Egypt. In United States, during the year of 2002, persons have AIDS is about 42,745. Rates are particularly useful for comparing the frequency of disease in different localities whose population differ in size. Rates are useful for comparing disease occurrence during different periods of time. For example, health authorities in Egypt announced that total number of SARS-CoV-2 in Egypt up to 8th of May 2020 is about 7,500 persons. This means that every 1 million in Egypt has only 75 infected persons. Another example that chickenpox cases in human in United States during 1991 is about 19.5 per 100,000 persons. Rate of disease among different subgroups can be compared to identify those at increased risk of the disease. This related to the occupational disease segment. The most prominent example we hear every day during pandemic of COVID-19 that healthcare providers all over the world have 10 to 13% of their total number becoming infected. So they so-called high risk segment or high risk groups have to be further assessed and targeted for special intervention. High risk groups can be also studied to identify risk factors that cause them to have an increased risk of the disease. While some risk factors such as age and family history for breast cancer or for occurrence of mastitis may be modifiable, where highly producing cattle in dairy farms with certain breed definition showing high mastitis rate of occurrence due to they are highly producers if they put in unhygienic conditions such as Jersey cattle. Epidemiology series will be continued by TVL channel, so please subscribe this channel to have the rest.